it's been a very, very interesting journey. I would say there's been a lot of learnings for all of us who've been working in the hospital. So if I may start, when it started last year, of course, it had just come in as a new disease, and none of us, people even working in the hospital center, did not have any idea about the disease, and it was all test and trial. But yes, because the numbers were not too many in the initial phases, so we were able to manage it quite well. And specifically, I'm talking from my own experience because I work in a private hospital in the heart of Delhi. So we, of course, became the COVID center. So we had good 500, 600 odd patients at the peak in the first lot itself. Again, the basic constraints of not being able to meet the patients, we're talking to the patients on the phone, the requirements of the foods, which were very, very different, and something which was very new because there was no, sense of taste and smell. So those were the learnings which we had in the very first phase of the COVID-19, which had stuck. There was another section of population which was in the home quarantine. Now that was another very interesting group of sections because from the hospital where I work in Max Healthcare, we also have a separate entity which is the home care. So I was also looking after at the same time almost about 100, patients who were self quarantine and were undertaking the home quarantine facility, wherein again we used to speak to the people, tell them about the do's, don'ts. And again, I think we've all realized during this 1.5 years episode that diet is very, very important, not only to prevent the disease because it helps in to build up on your immunity, but even people who've undergone this disease and have had this disease, be it the complications, be it even asymptomatic but were restricted at home, diet played a very, very important role. And again, now that we are at the end of the second wave, and we have a lot of complications which we get to see in our patients, again the diet has become very, very important because most of the complications set in if the diet is not good. So whether it's high sugars, the comorbidities not being controlled, like high sugars, high hypertension levels, comorbidities like cardiac issues, etc., they all precipitate from not eating a healthy diet. So I think this pandemic has given us important lessons. One, of course, that your lifestyle, the way you lead your life is very important. Second, your immunity plays a very, very important role. Third, how good your comorbidities are controlled. Certain things like, overweight, obesity, probably we never took it so seriously. But now we realize that a person who is obese with the same age group probably would have much more higher complications or would land up with a higher mortality rate as compared to the same person getting the same rate of infection, but probably not having the comorbidities. So yes, the importance of health, importance of diet, importance of leading a healthy lifestyle are the important takeaways or important lessons, which I think not only we as healthcares have learned, but I think the community in general, of course. So, as I said, the first phase was, difficult, new for all of us, but somehow we managed. But when the second wave came in, it was actually a complete turnover. I think whatever we'd learned in the past 1 year did not work this time because the hospitals were overwhelmed with patients, and it was like a sudden jerk of patients who were just poured in. Two, three things which probably helped us to, overcome this wave. And now that hopefully we're settling down and never get to see this pandemic again. But, the few learnings what we saw was there's a certain a section of populations which could be managed at home. So, and even as dietitians, we had a very, very important role to play because even our patients because I can understand, the psyche of a patient is the moment he gets this disease called COVID-19, he wants to rush to the hospital and, has to, probably segregate himself from the family members. And that is where even our counselings helped a lot because hospitals did not have beds. So we were trying to manage as much as possible at the respective home. Again, the diet became very important. The doctors, of course, were at the forefront telling them about the medications and all. The second group of people, as you just mentioned, the people with high comorbidities who actually had a lot of complications landed up in the hospital. Now, these patients, of course, most of them were in the ICUs. And sadly and truly, but because we could not meet them directly, so there was this FaceTimes, which we used to talk to the patients on the phone, call them. So technology was a great help to us during this entire wave, which we just went through. And we used to, and of course, the diet was a very, very particular to the T as per their comorbid conditions. So people with diabetes, the sugars with the influx of use of a lot of steroids and all, the sugars were very, very high. So we had to be very, very strict in terms of the diet so that the recovery could be fastened. And now also, as I talk to you, probably we do not have any, we have zero COVID cases in the hospitals, but we still do have a lot of patients who have recovered from COVID but have landed up with the COVID complications. And that has been only because of the various comorbidities which these people were already having. So be it diabetes, be it your kidney malfunctionings, or even overweight for that matter, which has probably landed up in them in this complications, post COVID complications. And again, the diet plays a very, very important role. So yes, there have been a lot of learnings for us, but managing them with the right diet, with timely interventions, and of course the right medical intervention has helped us tackle most of these conditions. There is, so there are two three things I think with the hospitals which can be managed, in fact manages much better than what we do it at home, because I am also coming to the hospital, but it always seemed to be easier to manage in the hospital than at home, right? So yes, we have different sections altogether. So we have a separate building which is like the COVID building, so all our patients over there, even the people who are handling the COVID patients, so whether it's the housekeeping staff or our F&B staff, or the doctors who are there, they are completely segregated in the sense that they would not come and mix with the normal, the not so healthy patients, but not the COVID admissions, the normal patients. So they are completely segregated. So that's one thing which really helps. The second, of course, is the basic principles which need to be followed. And I think working in a hospital, these are the some things which probably we've been, getting trained day in and day out, has become a part of our lifestyle. So when the moment we are entering the hospital, hand hygiene becomes very important. Wearing a mask becomes very important. Entering the COVID ward with the PPE kit is very, very important. And last but not the least, I think the vaccination is something which has really helped the hospital, the healthcare in total, going past this wave for sure, because all of us, some point or the other, have gone inside the ward, have interacted with the COVID patients. But luckily, during the second wave, the healthcare workers were saved to a great extent. And I think it's probably because of the vaccination that all of us managed to take it on time. So in a country like ours, when we actually think about malnutrition, the only section which comes to our mind is probably the poor sections, probably on the people on the road who are actually famished, very thin, probably stunted growth, are considered to be malnourished. But let me tell you, especially now that I'm speaking from an urban city and sitting in a private hospital, malnutrition is far more prevalent in the upper middle class, in people who are obese, because we actually, when we talk about malnutrition, there are three sections of population. So one is, of course, the undernutrition, or what we say is, people who are the category which includes your wasting and stunting. The other category which we completely ignore is the micronutrient deficiency, which has become rampant. So any kind of vitamin and mineral deficiency over a period of time is also an indication of malnutrition. And the third category of population, which is again increasing exponentially, is of course your overweight. And during this pandemic, what we realized was that it is this overweight and the micronutrient deficiency, these two segments of the population got affected the most, because the vitamins and minerals are the key for your immunity building. So people who are deficit in micronutrient would probably have a lower immunity, and hence more prone to COVID-19 infections. And the second section of population, as I just said, the obesity or the obese people, again, their immunity levels are much less. They are more prone to infections. And if they get the infection, the rate of complications are much higher in this section. So we really need to categorize these three conditions and then probably focus on all of these independently. When we say micronutrients, it means these are nutrients which are required in very, very small quantity, in milligrams and micrograms, but they play a very, very important role. So whether I talk about calcium, iron, my selenium, my magnesium, now these are important minerals and vitamins which actually help to digest or absorb my macronutrients. So even if I'm taking enough of my proteins, enough of my carbohydrates, if I do not have adequate amounts of my vitamins and minerals, none of these foods will get digested, none of these food will get absorbed. So they form very, very critical part. And in fact, we tell them that they are actually the joining or links between what you eat to what gets actually absorbed. So micronutrients are very, very important. Now, how do I get to know? Because obviously you cannot test yourself every now and then, but simple things like feeling tired, if you're not active through the day, if you feel that by the end of the day you feel very, very tired, or there is a lot of pain in your calf muscles or your shoulder muscles, or probably even there is a little bit of haziness, or you suddenly feel very down, or there is a lot of palpitation which goes on, these are simple, I would say not physical but just simple ways by which you can probably associate them with micronutrient deficiencies. But yes, there are definite signs and symptoms, which we call them the clinical signs and symptoms, which will tell you about iron deficiency for sure. So you get it to see from your nails. If you get cracks in your lips, for sure it's like a vitamin B complex deficiencies. If you get a lot of uh, you know uh, patches in your skins and all, those are very clear symptoms of vitamin deficiency. So yes, there are clear clinical symptoms, but those would probably manifest much later. Just simple signs of feeling weakness, dryness, feeling very thirsty, a lot of pain in your calf muscles and your shoulders are simple signs which tells you that there is some kinds of micronutrient deficiency for sure. If you see the global figures, or if you see our global the hunger index, which was just released in 2020, India has a very poor picture to show for sure, right? So definitely it is there, very, very rampant. But definitely, if I could say that if you're talking from the urban population, it is much, much less. Stunting even lesser, because that is like a chronic malnutrition. Probably we see more of acute malnutrition, which is generally precipitated in the form of wasting. And yes, that we definitely get to see even in the urban sectors. And that's probably because of the lack of information rather than saying the lack of availability or non availability, right? So the wasting is still very common, but not so much in the stunting. But yes, as and when we go into the villages or into the interiors, we get to see more numbers of the wasting and stunting for sure. Yes, immunity is the key word, and we're all working towards immunity. But what we really need to understand that yes, diet is very important, and that obviously forms the majority of the chunk when we talk about immunity. But besides diet, the important other key factors are, first is physical activity, very, very important. And that's what we've been telling people time and again, that they have to make sure that they have a good active lifestyle, any form of exercise, but that's very, very important. The second is, of course, maintaining the ideal weight. Obesity is a deterrent to immunity and getting falling prey to any of these infections. So you have to make sure that you maintain your ideal weight and be healthy. Third is stress. Stress is a big deterrent for lowering your immunity. So make sure that, I know these are trying and tough times for all of us, but making sure that you cut down on your stress really helps. Fourth is adequate sleep, very, very important. So I think when the pandemic started, all of us at home, it was a good beginning. People started mixing with their families, there was a lot of interactions and all. But because probably it stretched too far, and during the second wave we found that the stress levels, the lack of sleep, etc., were major factors which probably lowers your immunity. So besides diet, these are equally important. Now, when we talk about diet, simple things like going back to basics, eating local and seasonal, that is the best way you get all your nutrients in a balanced quantity. Whenever you're taking a local food or a seasonal food, always remember it is the cheapest, so you can afford it very well. Second, the nutritional quality is the highest in any food which is grown locally, because it actually you're not storing it, there's no transport, there is no there is no loss of nutrition because of the storage or because of the transport. So the best thing is for any person is to go and look for foods which are locally available, local to that region. Go for seasonal fruits and vegetables because that is loaded with nutrients. Second is portion control is something which I always tell people about, and this is specifically for people who are overweight, not exercising, leading a very, very stressful life. Because if you are able to control the portion, even if you're eating something wrong, if the portion size is controlled, probably it's not doing so much damage to your system. So these two things, if everybody can follow, I think half the concerns about unhealthy eating can be wiped off completely. Just communicating what we are doing right now is one of the simplest way that the message can just be spread wide across. So yes, technology has helped us a lot. So probably sitting over here, you can disseminate the information across the globe in seconds. That is one of the important thing which of course the technology has done. But yes, what is actually required is in cities, yes, the information, people have become very, very aware. People are very, very conscious about their health, about what they're eating, and there is a lot of information which is provided. Where we are actually lacking and the bridge needs to be gapped is, of course, when we go back to our villages, and that is where the information needs to go in. And I think that is again where the technology can be of great help, because it is only through that these simple information with regards to what to eat, go for seasonal, look for food which is right across in your village or in your locality, and of course doing a lot of physical activity. These are simple things which I think if the information can be disseminated right down to the community level at the villages, I think that we'll be able to tackle malnutrition or any kind of diseases for that matter. So ideally, for a healthy population, we do not require any supplements, right? Right. So our body is made in such a way that our absorption is increased when we have an increased requirement. So taking a simple example, for example, for a pregnant lady, because her requirements of irons are is many-fold higher as compared to a general adult population, her body can also absorb more. So our body is made in such a way that when our requirement increases, our body also absorbs better. So definitely for a healthy adult population, there is no requirement of supplements whatsoever. But yes, when there is a diseased condition or where there is a malnutrition or where there is a long stay of comorbidities, be it diabetes, hypertension, cardiac issues, kidney problems, yes, there is a requirement of certain kinds of supplements, but it is again very, very important that it should be taken with caution under the supervision of a nutritionist or a doctor for sure, because toxicity is also becoming a concern. And that's what we've seen during this pandemic, that everyone, each one of us, including me, have been we've all got dependent on whether it's vitamin D, whether it's zinc, whether it's vitamin C. So probably it helped us for some time, but then after a certain period, it just precipitated as toxicity. And the toxicity has much more health repercussions than probably getting into a deficiency. So it's been very, very difficult for all of us because there's been a lot of anxiety in the first time, in the first phase when it dropped in, and obviously going back, getting back to your family, interacting with your family members, your children, etc. So yes, the anxiety was very, very high. But as I said, simple things of the constant training which we had undergone in the hospital, that really built in a lot of confidence in us. So that was very important. Following instructions to the T is something which we have to do it nth time. So it's not that you wear a mask today, but you forget to wear it tomorrow. So that doesn't help. Even after getting vaccinated, we've been very, very particular now that we don't even have any COVID patients, but we still make sure that the moment you enter the hospital, you are wearing your mask. The third is, of course, making sure that you eat healthy, because at the end of the day, we realize that it all comes down to your immunity level. Even if somebody gets an infection, if you have a good immunity level, probably you'll are able to fight the disease better, and probably you probably just become asymptomatic very soon, and get over the disease very. So eating healthy is very important. And last but not the least, which has worked the best for me, is exercise. I make sure that I do some form of exercise, even if it is a half an hour or 45 minutes, but a combination of aerobic and an anaerobic. It's not only helps you to de-stress yourself, releases the good hormones and you feel much better, but at the same time it actually helps, has multiple benefits of improving on your immunity, maintaining weight. So yes, exercise has been the crux of my healthy living for sure.